I want to start by giving an introduction of this particular series. This is our second series, and it is driven by a principle of town and gown. And you probably have heard of that word, town and gown. And what that exactly means is that we want to bring the university to here, to PVA, and for PVA to go to the university and share with us the vast experiences that we have. You know, I like to say that each one of us sitting here is a living treasure. And it is, no matter. So, this is quite a tradition for most universities in bringing the universities to the community. And we have lots of experience doing it. Mel Garber, who was Mel, and he's been on the extension service for many, many years. Essentially, he goes to the community and bring the university to the community and back. I think Carolyn Hatfield, I don't know what Carolyn is, and she worked at the Georgia Center for many years as well. So that's lots of experience of town and gown, kind of a win-win collaboration. And so that's driven the first series that we had, and it's driven the second series. And I think many of you possibly enjoyed the talk by Michael Gorge. And I heard a lot of talk about how good he is, and indeed he's very good, from Emory. Now, if you weren't there for the first talk, Kelly Atkinson had recorded it. And I'm going to ask Kelly to say a few words about how you can get to that if you want to see it again, or if you haven't seen it, you can do it the first time.
Okay, as of yesterday, the recording of the last lecture is completed and is up on YouTube. And I will send a link via Wellzesta that you can link directly to that video. However, there is a change this time. When you see the video, you'll notice down in the lower right corner a little red square with an arrow in the middle of it. Click on that and you'll have a subscription to the channel. What that means is you could go on anytime and see any of the videos that we have done for PVA. And I've had many requests for that, and I'm happy that I finally figured out how to do that. So I welcome your viewing it. They're excellent. I have, in conjunction with editing them, I find that much of the material that is in the lecture, I miss it first time through. So I can recommend reviewing it, and particularly on these issues that are such a big factor in our lives as senior citizens. So that's what's coming up. Abigail has the announcement. Once that goes out on Wellzesta, you should be able to connect to it and go from there.
Thank you, Kelly. Kelly is doing it on his own, using his own equipment. And if you have done any editing to put together video, it's very, very time consuming. And Kelly has spent the time to make it as good a video as it can be. It's high quality. So now I want to say thank you to the organizing committee. That's me, though. No, I think there's kind of a large group of people putting this together. It's a lot of telephone calls and lots of adjustment on things. So this time it is the organizing committee is a combination of University of Georgia, from the Department of Kinesiology through the College of Education, Dr. Jane Zhu, and Dr. Deborah Barani. And they took the lead on exercise and movement, and also movement disorders. And then the other side of the coin, is through our speakers at Emory, Georgia Tech, but the other collaboration is at the Institute of Gerontology. Lisa there, she's famous of talking without a mic. And Janae here.
Good to see you all.
See, she doesn't need a mic. And I'm happy to pass the introduction of Steve Wolf to Jane. I've known Steve since I first came to Georgia. I think I came in 1985. And he is the leading researcher in balance and fall in the world. And he has published quite a bit. And the thing that he's kind of shaking his head, he was given the honor of a living legend. And that's true. He looks like a living legend, doesn't he? And he told us a story that he had a living legend t-shirt, and when he went up for a talk, he took off his coat, he took off his tie, then he took off his shirt. And it says living legend. And I think Steve would have to say what is on the back of that t-shirt. So, without much to do, I'm going to pass this mic to Jing, and Jing can introduce him.
Okay, it's my great pleasure to introduce Dr. Steve Wolf. He's a professor and director of research in the Department of Rehabilitation Medicine and a professor of geriatrics in Emory University School of Medicine. He's also an associate professor in the Department of Cell Biology and a professor of health and elder care in Nell Hodgson School of Nurse in Emory University. And he's also a senior research scientist in the Center of Visual and Neurocognitive Rehabilitation in Atlanta VA healthcare system. So that's actually only very few of his long titles. Okay, and he completed his PT training in Columbia University in 1966 and Boston University in 1969. And he received his PhD in neurophysiology and anatomy from Emory University in 1973. That is the year when I was born. And then he finished his two years postdoc training in Caroline Linska Institute in Sweden, and then Emory University in the US. So he has received numerous honors and awards, too long to several pages, so I have to pick just a few of those here. So he has been a keynote speaker for 11 physical therapy institutions in the past 2 decades. And so some awards from American Physical Therapy Association, just name a few, okay, again. Marianne Williams Award for Research, Golden Pen Award, Distinguished Service Award, and then this one is truly reflecting his lifelong dedication and accomplishment in the field, called APTA Living Legend. That was 2009. And so if you at the reception, if you ask Steve about his achievement, you should ask things after that year. To just mention one of those, we were talking about at lunch actually, and also this morning, he actually gave us another talk on stroke recovery. We were talking about Wolf motor function recovery test. So when people have a stroke, unfortunately, and you need to test their motor function, and so after all these years, people figure out that this is a very effective, comprehensive test. And they decided, okay, we're going to name this function, this test after its inventor. So that's why it's called the Wolf motor function test. Okay. And there are a few other awards: American Society of Neural Rehabilitation, Kenneth M. Visti Award, and GSA Joseph T. Freeman Award. Okay, I'm not going to continue with this long list. And so Dr. Wolf is also, so besides falling, which you're going to hear today, he is also a world-leading expert in stroke rehabilitation. So within the past 23 years, he has led several NIH-funded clinical trials to explore novel interventions in stroke motor function recovery. The EXCITE trial, specifically I want to mention that, led by Dr. Wolf, was ranked by JAMA Journal in 2006 as the top 15 research study over 7 decades. So this trial has established the current field gold standard in stroke rehabilitation. So now back to our topic of falls prevention. So I looked up Dr. Wolf's papers, and there were at least more than 30 papers on the topic today, right? Using Tai Chi to prevent falls prevention. One of the papers is titled Exercise Training and Subsequent Falls Among Older Persons. That was published in 1996 and was ranked by the JACS paper. It's called Paper of the Decades of the 90s. So I think that's a lot of information, and then Dr. Wolf is going to tell us about his all his knowledge about falls prevention today. And just a little story before he starts. Dr. Wolf likes running. Okay, and then so he's very, very diligent, and they always start at 6 o'clock in the morning, always. So, and there was this conference, it's called Society for Neuroscience, and usually goes to, because it's too big, so only 3 big cities in the US can host it. One of those is in California, San Diego. So this year, Dr. Wolf went there, and he diligently, so after the conference, he makes sure he always come out, and at 6 o'clock in the morning, he will go for a run. But then this first day of the conference, it was very dark outside, 6 o'clock, and he runs, right? And not any people, but I guess just a few homeless people there. And after he finished, he realized, oh, what hour was it? Or 3 o'clock in the morning.
The stories about running are been exaggerated nowadays, just so that we all feel comfortable together. When I go out running in my neighborhood, people will drive by and they don't know whether to wave or dial 911. Can't hear me?
Not well.
Is that going to be better?
She's turned it up. Just talk to us again. I think she turned it up.
Okay, is that better?
Yeah.
I'll be back in an hour. So what I was saying is that the running skills are profoundly exaggerated. And now when I go running, the neighbors don't know whether to wave when they drive by and dial 911. Because I move pretty slowly. That's what I do. So let's say one more thing before I thank you all for coming today. I always believe that there should be a take-home message at the end of a discussion. So let me do that now. A lot more to do than with strokes or Tai Chi or falls. Several years ago, at the stroke conference at Emory, I was asked to be one of the speakers. And we were told that at the end of the conference, each of us should summarize what we think is important, but we're only allowed 2 PowerPoint slides and no more. And predictably, many of the folks who were presenters had so many words on each 2 slides, it's almost impossible to read them because the font size is so small. And I only had 3 words on my slide, and this is the take-home message. Those 3 words were move, move, move. Whether it's your mind or your body, keep moving. And that's fundamentally my message. You need to decide what that means to you, but it needs to mean something. And if nothing else is derived from the time we have together now, just try to remember that. I think it's very, very important. Now, to clarify some of the confabulations that you've heard about for the last 5 minutes or so, I've been at Emory for a long time. I'm a physical therapist, initially by training, and a neuroscientist as well. My passion and interest in asking questions. I actually got thrown out of PT school at Columbia for asking too many questions. I really did. That's a whole other story, but I was reinstated, fortunately. Because back then, you weren't allowed. You should be asking questions. You just take the orders, and that's what you do. However, just to make a few points clear, my passion has always been trying to come up with ways in which we can help people who have strokes move more effectively and understand what's going on with these different interventions for that to happen. So what's that have to do with aging, falls, Tai Chi? A very interesting path we all need in our lives. And this particular path led me to Tai Chi. How did that happen? Amongst my interests in rehab was the use of biofeedback. Perhaps you've heard that before. It's different instruments that give you information about some aspect of your physiology, your function. And you can, by giving visual or verbal cues of that information, help to change the appropriateness of your responses. In around 1990, the National Institute on Aging had a proposal for different centers to determine ways in which they could reduce or delay the onset of falls and improve frailty. In fact, the trials that were awarded to 8 different locations were called the FIX studies. Falls and injuries, preventive falls and injuries in older adults. That's what that stood for. My interest in biofeedback, and maybe some of you have experienced this, was in the development of what at the time were brand new posturography machines. Those are it's a fancy word for standing on a platform that when you move gives you information about the change in your center of pressure or your balance. Usually an icon that moves on the screen. And you can train people to move, increase their motion capabilities under stable conditions or if the platform moves. And I thought that would be a really neat thing to study. Studying brand new posturography and a controlled clinical trial. Compare that to a control for exercise, wellness and education. And starting to put this together, I had to put together a team of individuals who knew something about environmental hazards, behavioral measures, and how they affect us as we get older. And one day, as I was trying to assemble this team, this gentleman who was a professor of biochemistry at Emory came by, and he happened to be a Tai Chi grandmaster. And he said, I want you to study Tai Chi. And that was new stuff. Now, at that time, this is 1990, there was no Center of Complementary and Alternative Medicine at the NIH. There was an office of complementary medicine with a $3 million budget in an institution that at the time had a $20 billion budget. So it was not considered significant or important at all. No one was doing any work in alternative forms of treatment. And we met several times, and I talked to the group, and I started thinking, high-tech posturography, low-tech, a time-honored exercise form that has been in existence in China and in Asian cultures for over 300 years as a practicing art. High-tech, low-tech, expensive, inexpensive, west, east. Matter of fact, in many ways, they were diametrically opposed to one another. So I said to the group, you want to do this, have 3 arms, a Tai Chi arm, the posturography, and an exercise, a control for movement. And they reluctantly said yes. So we submitted this proposal thinking, whoever reviews this is going to believe we're totally crazy, or it's crazy enough to give it a try. And lo and behold, it was accepted as one of the 8 centers that had funding out of over 50 centers that had applied. Moreover, as it turns out, all of these centers had to have common outcome measures. And the most important one is the measurement of time to first fall. Assuming that as we get older, no matter what we do, we're bound to fall. And can we delay that? That's the fundamental question. As it turns out, the most potent intervention in the country was Tai Chi. And I looked this up just yesterday. That study was published in the mid-90s. At that point in time, among the (3,593) articles that have been published on Tai Chi to date, at that point in time, there were 166. And of those 166, if you line them up chronologically, our study was the 3rd study in real time to be published in the United States. And now we're at 3,593. Didn't realize that until I looked this up the other day. So what we were doing was relatively novel, and I was very pleasantly surprised when the major geriatrics journal, the Journal of the American Geriatric Society, voted that paper the paper of the decade for the 1990s amongst all the ones that they reviewed, because it stimulated an interest that has, I think, percolated to this point in time. I know of very few independent and assisted living facilities in the United States that don't, in one way, shape, or form, have a Tai Chi or alternative medicine intervention as an opportunity for its residents to participate. So I asked him, can I presume that that's an opportunity here? It is. Okay. So I don't like this thing about this motor function test. I don't like the names and stuff. I am proud of the fact of those the things that we've been able to accomplish. We started all of that right here. There were no centers anywhere in the United States in which there were Tai Chi trainers or practitioners up to that point in time. And for those, can I just see a show of hands for those who have participated in that in some way? Tai Chi here? Several of you have. And amongst all of you, to the extent that you're comfortable raising your hand, no mandate to do this. How many of you here have experienced at least one or more falls? Still a relatively small number, unless there's several people who are uncomfortable raising their hands. I understand that. So the whole idea underlying this is to try to delay the onset of falls. To think that we're going to eliminate falls, I think is a little naive. That's not going to happen. What we can do is figure out ways in which we can delay the onset of the first or subsequent falls. And the way one tries to do that, of course, is to come up with interventions that will allow us to be more aware of when we're losing our postural control. And we will prevent a fall by maybe being able to take several steps to regain our balance rather than fall. Any intervention that provides that opportunity, you learn something. So I want to ask you all a few more questions because it'll help shape the conversation for today. Is there anyone in the room who is involved in any kind of training or service provision for exercise in any form for just curious village in the room right now? Is there anyone here? Many. Because I don't want this to be a monologue. I want this to be engaging conversations. I'm going to try to draw as many questions from you as I possibly can and have Lenny assist me in answering. I want to create a dialogue. But first I thought, well, let's do a Tai Chi session. I'm going to do a simulated one just so people get an understanding philosophically of what's going on. It's just too large a group to try and do something more dramatic than that. So we'll get to that in a few moments. I'm going to list a series of concerns that I think you all have. And I'm going to read them to you first. I'm going to read them to you first, and then I want you to raise your hand for the one that you think is most important to you. Here's my list. And if it's not on the list, you let me know. Here's my list. Balance and falls, memory, nutrition, exercise, companionship, arthritis, lung, pulmonary function. Say it again. Balance and falls, memory, nutrition, exercise, companionship, social gathering. Lung function, arthritis, and the joint pains that are associated with arthritis. Okay. So let me, now I'm going to ask for a show of hands for which one you think is the most important. They're all important, I don't think we argue that. But which one to you personally is most relevant or important to you? So, balance and falls.
None of your list.
Ma'am?
None of your list.
Well, okay, give me one, please.
Sleep.
Sleep? Very good. Glad sleep. Quality of sleep, I'll say, okay?
Staying asleep.
It's part of quality. It's to get up in 2 minutes, like, it disrupts your sleep. You know, it feels useful. Okay, I'll add that. Thank you. Let's start again. I'll add sleep to this. Balance and falls. Memory. Nutrition. Exercise. Companionship. Lung functions, breathing, pulmonary function. Arthritis or joint pain. And sleep. Well, it's very interesting. I have a feeling if I did a count, the total number I counted up was more than the number of people in this room. But that's okay too. That's okay too. But it's interesting. Just looking at a show of hands, there are some, shall I say, favorites, preferred ones here. Certainly in balance and falls. Exercise, companionship, joint pain or arthritis. I saw a lot of hands raised for each of those. So what I get from my little list of inquiries here is that the concerns that you have as individuals within this total group span quite a spectrum. And so what that tells me, that at least, and I think it's representative of the overall aging population, that we see a multitude of personal problems, and they're not the same for all people. So that tells me that if I were coming to organize a series of courses or opportunities in an independent or assisted living facility, I'd probably come up with a very diversified program that could be configured in some very specific ways based upon the needs of the collective group. It's kind of like everything in life, you know, I've learned this as a clinician and as a researcher. I've worked a lot of, just a lot of work in stroke. A stroke is not a stroke is not a stroke. No two are the same. The same thing for our issues as we get older. And you know, I hope, how many of you have heard the phrase personalized or precision medicine? Have you heard that phrase? You should become familiar with it. I think it resonates with all of us. Here's the concept. The reality that with all of the advances that are being made in healthcare, that you take any one diagnosis and not everyone is the same. And that what needs to be done is some degree of specification of the activities or the plan for each person based upon their specific needs. Everyone kind of nods their head and says, that makes perfect sense. The conflict that everyone also agrees with is when you try to study these things, the typical medical or research model states that, well, you have to have everything well controlled, so you can't do a whole bunch of things you not understand what's most effective. And it could be that the answer lies not in that question, but the question of what can we configure as a plan for any one person, and how many other people with that same diagnosis, and aging is a diagnosis, fit that bill so they fall within that same prescription, which is not exactly the same for everyone. I don't think there's anyone who would disagree with that concept. It makes perfect sense. It's the willingness of us as a society to acknowledge and accept that that's the way things should be, and a way to convince third-party payers that a treatment plan doesn't have to be a script that has to be followed. The surgical model kind of dictates that. There are certain surgical procedures that should be done for certain diagnoses. And I'm talking about medical care and quality of life care and the ability to persist in independence as much as we possibly can. And there is no one treatment that fits the bill for everyone. My interest in talking to you today primarily lies in this concept of Tai Chi. And I want to tell you something first before we move on to a little fun together, trying to do this. For the value this will have for you, as a member of the American Physical Therapy Association, I'm also a member of some specialty academies within the Physical Therapy Association, and one of them is the Academy of Geriatric Physical Therapy. And it just so happens that in June of this year, they published an executive summary of the guiding principles for the best practice of geriatric physical therapy. And I want to share this with you because it's not, you'll find that in your brochure, but I want you to listen carefully, because I think there are a lot of physical therapists who are geriatric specialists who now will be adhering to these principles. And here they are. And hopefully they'll make sense to you. And the reason they sound so obvious is because in certain ways they are, but they haven't necessarily been adhered to within the scope of practice of geriatric rehab. So, here we go. The patient is the primary driver of their plan of care. It's not just what I do because I like to give people exercises, etc., etc. What is it that the person wants to optimize the quality of their life within the context of a physical therapy rehab process? Strive for anti-ageist practice. What does that mean? There is an inherent belief that there is a bias, usually unconscious, or negative attitudes about aging and geriatric attitudes. That people in the healthcare system often falsely presume that because someone is older, they won't understand, or that what we want to do subjugates them in some way rather than elevates them. And this principle says this is no longer acceptable. One needs to come up with sound treatment plans and measures that relate to the patient's stated goals, not to what you want to do because you think you're going to get paid more by doing that. There's a difference of what the patient stated goals are. And one more take-home message, if I may, because I've heard this time and time again. The therapist, the physician, I don't care who you're talking to who's treating you, has to listen very carefully. And if you don't think they are, you need to let them know. Because the adage is, listen carefully to the patient. They will tell you what's wrong, and they'll tell you what they need. Not what you think you know, because you've gone to school for so many years, you've seen so many patients. But we, as consumers and patients, need to advocate for telling those in charge of our health care what we want, not what they want. And if you have the right and the privilege to ask for that. There's nothing wrong with you saying to your physical therapist, occupational therapist, physician, you're not listening to me. This is what I need, this is what I want. I know best, you don't. You may know what the best medicine is to prescribe. If one doesn't work effectively. But in terms of, it's my life, and in terms of the quality of my life, I want it to be optimized for the time that I have. So please listen to me. We need to be our own advocates, and that's what this principle is stating. Physical therapists, in providing treatment to you, not only should listen to you, but are obligated to be aware of the existing literature and use the best care practices that exist for which there is evidence. Many people don't do that. They do treatment approaches habitually because it's been done for so many years a certain way. That doesn't necessarily mean it's the best way. There's a lot of work that's done, and so once again, it doesn't hurt to say, in what you're prescribing for me, is this the most recently available information for which there's evidence, as opposed to you're doing it because you're used to doing it. They're not the same. Once again, we need to be our own advocates. Part of the rehab team, the treatment team, is the care partner. The care partner should be involved with all decisions that are made about rehab and actually be perceived as part of the team that's participating in the decisions that are made and how they are implemented.
Doctor?
Yes.
Excuse me.
Yes, sir.
What do you mean by care partner?
Your spouse, your best friend, the individual who you associate with most intimately or closely in sharing your health care concerns. That means different things to different people. That's what I mean.
Thank you.
Sure thing. There's a need. How about that? You actually woke me up. In terms of exercise, let me ask you a question. What percentage of older adults feel documented to participate in the recommended amount of exercise per week? 10%, 20%, 30%, 40%, higher or lower? 20%? Any other choices? 10%? Okay. Only 8% of older adults participate in the recommended 150 minutes of moderate to intense physical activity and 2 sessions per week for strengthening exercise. 8%. And that sounds like, boy, that's a lot of stuff to do. Those numbers aren't made up. They are the minimal amount of exercise, both in terms of strengthening, endurance, walking, those kinds of things, whether you require an assisted device or not, to maintain at least the status quo of your health, if not improving upon it, for your mobility. And it is surprising, to me at least, that that percentage is as low as it is. And that's recent data. So move, move, move. Once again. So those are things I just wanted to share with you very briefly. Let me stop at this moment before we go on to a few other things. And let me ask if there are any questions. Yes, yes, sir.
What were the minutes per week that you just mentioned?
150.
150.
Yeah, of exercise. So that was at almost 3 hours, 2.5 hours. And if those are, I would bet that there's some people in this room who feel that's a lot. It's an awful lot. 2.5 hours for a week. But it's not really. And if it is for you, just like we talk about falls in a few moments, you can chart this yourself. You don't have to do 150 minutes straight off. But what you need to do maybe on your calendar, okay, at the end of the day, a little watch, I walk so much, or a step counter, if you have a step counter watch, to see how much you've done. And you say, I want to increase that tomorrow. Not by a lot, just by a little, progressively. This is not a contest, it's not a race. But the more you can do, the better you're going to feel, and the more active you're going to be. Because as we get older, inactivity builds upon itself, and we don't want that to happen. The question here, somebody raised their hand a second ago. Oh yes, there you are.
Yeah. When you're talking exercise, are we including such things as a lot of us here are doing things in the activity area such as water aerobics or balance classes? Does that count?
It absolutely counts. Everything that involves movement, non-stagnancy, activity. That's why I kind of like, this happens to be an Apple Watch, but I had a Fitbit before that. I chart my steps. Steps, by the way. Sure.
Just walking to the dining hall.
Sure. But even these watches react to movement of your arm, and its resumption is you move your arm, moving your feet. Not necessarily. I mean, I prepared a big salad the other day for 6 people, and chopping everything up and putting it. And I was surprised that by the time I was finished, I looked at my watch, and that had over 400 movements just in the process of retrieving, cutting, organizing, and whatnot. Yeah, it sounds silly, but those are movement exercises for your arms. Every portion of movement counts. That's why I advocate some kind of measuring tool if you have it. They're very inexpensive these days. Another question? Yes, sir.
Two words which I think if you wait, if you're very quiet, you can actually hear it happening. Sarcopenia and osteopenia. So we lose muscle mass as we get older, and we have to get it back, or can we get it back? And we lose bone strength. Can we get that back, or can we not get that back?
You want to come up here and do the answer is yes, we lose muscle mass, and our bones become a bit more brittle as we go, especially women more than men. The weight-bearing and loading activities are always good if they're done carefully, especially for women who have osteo weakness, bones that are becoming a little bit frail, that are potentially suspect to fracture if one falls. So loading activities, weight-bearing activities, even carrying things in moderation is there to help reinforce bone strength. The other factor that contributes to that is diet. Eating appropriate healthy foods that have calcium supplements and nutrients within them to reinforce bone strength. In terms of the sarcopenia and muscle loss, yeah, muscles start to atrophy. Can we build them up to the way they were when 20 or 30? Probably not. Most people can't do that. But we can delay the rate in which there's any degradation in muscle by being active. And it goes back to the move. It really is important to maintain a level of activity. Yes, ma'am.
I just wanted to say the nicest thing I heard you say, though, and even if people can't move, to move your brain. Because as we age, the physical movement becomes more and more difficult, and maybe it's a stroke or whatever, you don't have that mobility. But moving your brain, can you elaborate on what we do to help that?
So there are reams of books, puzzles, games that test memory, that are interactive. And this is not a thing you do necessarily have to do on your own to try to enhance your recollection. I find as I get older, and I dare say I'm probably as old as many people in this room, that I'm finding my ability to retrieve names becoming more and more compromised. As I start playing games with myself, how do I do that now? I know that person's first name. Eventually, if I don't think about it, it'll come to me. Has anyone ever experienced that? Don't think about it, and it will come. So I start going through the alphabet, and I find myself suddenly narrowing it down to 2 letters. I don't know why, and then it'll come to me to start running the list. So everyone has different ways of doing it. My wife tells me that she can sometimes remember the name of one of her friends, but she can't really recall it, hasn't for a while, by the color of the clothes that they favor wearing. So blue. Why? I always say she wears blue. Because her last name starts with a B. That kind of. You can make crazy associations, but if they work for you, you go for it. The fun part of this unfortunate situation where we start losing our recall is try to figure out ways in which we can retain it that are personalized, they're yours. And so coming up with these games or approaches is very individualized and often very beneficial. So for you or for others, think of a scheme, a way in which you can try to retrieve. Let me ask you all. I find that my long-term memory, stuff that I did years ago, names, people I knew, that's remarkable. Some of the more recent stuff, because maybe I don't value it as much. I'm not going to remember a name when it's not important to me, or an event. I was talking to my oldest friend, goes back to when we were both 8 years old, and he and I chatted the other night, and he reminded me of things. I didn't remember the name of the dog of our friends who lived down the street 60 plus years ago. But he said, I can remember anything from the time I was 8 years old. But asked me who that person was I met yesterday. It doesn't mean that much to me. It has no true context. And we all decide what the value is. Not being mean to people. We make decisions about trying to retain a name because, gosh, that person's an ophthalmologist and I don't have them. I want to remember his name. Or their name is a circumstance. An old friend of your best friend that you meet for the first time and didn't know they were around and you want to retain it. It's the context of the information that we want to have the ease of retrieving as best we can. So I want to do a little experiment with you all. You have this, the brochure handout, right? And that's all very valuable information, and every bit of it's true about what the benefits of Tai Chi may have. And I really recommend that those of you who haven't tried it, to give it a go. And by the way, you don't have to be inactive because you're in a chair. And in fact, as an example, when we stand up and do some of the fundamentals of Tai Chi, you stand on your feet, right? I'll do this right now. You stand on your feet, right? Imagine you can't walk. So you have difficulty doing that right now. I want you to do me a favor. I want you to, not getting fresh with anyone, I want you to take your hands and put them under your butt. Okay. You should feel bones getting into each hand. Feel it? So when we teach Tai Chi, the folks have to come back there on the So when we teach this, we teach people who can't stand to use those bones. Those are their feet. So they're going to do weight shifting onto those, just like we do weight shifting when we do rotations. And so what you're going to do is sit. Oh,
Can you guys hear?
sure. Can you not hear me? Okay, can you hear me?
Even loud would be okay.
Hold that up there.
Oh.
There.
I'll tell you what, I'll do this. You have fun with your hands. I wish I could join you. So, what we teach folks is to visualize those sitting bones as your hands. Because there are movements that require rotation from one side to another, weight shifting. And what that will do, if you just try that right now, just very gently is turn to one side, take your hands, and slowly move them with you as you turn to one side. And then slowly back to the middle, and to the other side. So these are movement forms that are part of Tai Chi. But you're not moving, you're not walking, you're not twisting your whole body. You are exercising your trunk muscles and your rotation and your weight shifting. And if you sometimes feel you have problems with balance, because you move from one side to the even in a sitting position, this is an exercise, part of a whole routine of exercises. I have a book up here, and I'll show someone later if we take a break or something. Patricia Yu is an outstanding Tai Chi instructor on a whole bunch of Tai Chi exercises in sitting positions. So because you are immobile in the sense you can't walk, doesn't mean you can't exercise your body. You just use another image as your feet, and you can still do the rotations, the arm movements, except you're replicating the Tai Chi movement forms, but you're using your sitting bones for your feet because you can't stand securely. So hopefully, I don't know, once again, I'm ignorant about the Tai Chi training and instruction here. I have a hard time imagining that the instructors don't take that into consideration. The outstanding, by the way, Tai Chi instructors, we've had to deal with this over the years, those are people who were trained to modify Tai Chi movement forms for older adults. Not the martial arts forms, it's the modifications for older adults. And I'll just give you a simple example of something that can be done in the sitting position to enhance your mobility and your postural control as you move from one side to another. Can you do that if you have poor posture or poor trunk muscles? Can you do that without falling over to the side? And if you fall to the side, you've got the arm of the chair to protect you. Just a quick example. Okay, I want to do an experiment to tell you, aside from what you've read there, which is all very valuable, what I think is one of the most important aspects of problems that we have with respect to falls as we age. And I'm going to do it by way of demonstration. I need a volunteer, someone who says they're not a faller. There's nothing tricky here or anything. Can someone come up here and help me? Someone who's not a father. Thank you. First of all, I'm glad your name is
Emory.
and Steve. And I'm just glad that you're still here. Not too many people left, which is, that's the first one. Usually by now, you're all gone. What we're going to do, we're going to walk over there towards that door. And I want you to, as we're walking, I want you to tell me if you're enjoying this or not.
Yes.
Okay? Very good. And then we'll get over here. What we're going to do is we're going to walk back. And I need you to talk to me while we're walking. What do you like least about this facility? Surprise question, huh?
It's far away from my old church.
Okay, let's stop for a second. Now, just look at, now when we walk there and back, did you notice if there were on the platform, were there any chairs?
I didn't notice.
If there's chairs up there?
Wasn't looking at them.
You were looking at them while I was talking to you before.
I know they're there.
Okay. Hey, did you notice anything on those chairs though?
Not right now.
No. So when we were talking, and I had you turn to me because I wanted you literally to have your vision in that direction.
Yes.
You didn't process any of the information that's there on the chair.
No.
Because you probably saw it with your eyes, but it had no context value for you whatsoever. Nothing to do with our conversation. Yet you probably saw that, right? Now, if we walk back again, let's do it again. And I told you that. Stop for a second. So, the chairs are down, right? The chairs up there?
Yes.
And is there anything on any of those chairs?
Yeah, because I looked because
Oh, what
you
is
said
it?
something.
What is there?
I don't remember somebody else.
Okay, fine, okay. I want you to do one more thing for me. Turn around facing me. Now I'm going to ask you this slowly. This is not a speed test. I want you to turn 180 degrees so your back is facing me. Okay. And you said to me that, I'm asking you again, in the last year or two, have you fallen at all? Have you had any falls, any falls?
Probably a few slips in the step. You
Okay.
know, sort of your catch yourself.
If you caught yourself, and if there wasn't a railing there, you might fall?
I was away from railings. I just sort
You
of caught myself.
caught yourself. Okay, thank you. Now, is there someone who has fallen, has a history of falls, who's willing to walk away? I promise you I won't push you. No one. Okay. So let me try to make a few points. The last point about taking a 180-degree turn, it's not speed, just taking the turn. There's a physical therapist in the UK that was 30 years ago now, who did a correlation of the number of steps required to do a 180-degree turn and the incidence of falls among individuals. There was a high correlation for people who take 4 or more steps to make a 180-degree turn and falls.
But you added the word slowly.
Yeah?
You added the word slowly,
Okay.
and therefore she may have taken more steps than she could
That could very well be. Could very well be. Most people, even if asking you to
have.
slow
What rule
down,
followers here?
granted, maybe I should ask something. I feel terrible if I said, I want you to turn it around 180 degrees as fast as you can. If you fell, I wouldn't forgive. I'd never be able to live with myself. But most people take 4 or less steps to do that under regular movements. I didn't say as slowly as you can. That's the other thing. This is the most important. When we tried to, I told you I've done a lot of work with Tai Chi, and one of the things we had to do was determine the timing and frequency of falls. They had to be documented. We collected information from people living in their own environments, where most of them in independent living facilities. So 10 of them in Atlanta that were actually 20. 10 of them were having Tai Chi training, and 10 of them had a wellness education program, which is kind of a control for exercise. And we asked people to chart their falls, and we would look at the numbers of falls. When we did our evaluations, one of the questions was, okay, have you fallen in the last week? Yes or no? And every time someone fills out that form, what happened? Tell us in a few words. We actually wanted to have a checklist of the possible things that might have contributed to that fall. When we interviewed folks, I was surprised at the number of people who had fallen. And in describing their fall, would use the words, yes, I fell, but it wasn't my fault. And at first, I would think, as you might, well, you're all afraid of giving up your independence. And by admitting that blaming it on something else absolves you from any guilt or feeling that you're losing your control. And after a while, it struck me, why would so many people say the exact same thing? Maybe people trying to tell me something that they can't really tell me themselves. And it's not a question of losing your independence. And what we came to conclude, I could kick myself now if I could have done this all over again. The question I would be asking someone with a fall is, do you remember what you were thinking about when you fell? And when people said, yeah, I saw the rug there, but it's not my fault. I know that chair shouldn't have been there, but it's not my fault. That tells me you saw something. That's why I was asking about the question of what you saw on the chair. You saw something, but you didn't process it in the context of what you should do in a timely fashion if that obstacle was in your way, because you might have been thinking about something else. And we all have friends in this room who are maybe a little bit less mobile than you are, and I'm going to guess that you have friends who are a little bit frail, and when you walk and talk with them, you walk slowly, or they'll stop and talk to you while you're walking. I bet some of you can identify that with the people you know. I'm also going to guess that those individuals probably have a high rating of fear of falling, or they have fallen. And what's happening here? The divided attention capability has gotten so distorted that they can't do both. Can't walk and talk at the same time. Because the mental energy that's used to process one, that's what I'm going to say to you, while thinking of how I'm walking and not hitting any obstacles, I can't do it at one time. That's what you're saying, is telling one another when that happens. I can't process visual cues about what I should do if I see something that might trip, slip, fall. And what I'm thinking and saying at the same time, I can't put it all together like I could. And the telltale sign for that is walking slowly as one talks, as opposed to, that's why I asked you to talk to me. I wanted to see if you slowed down. You were a little, I tried to keep pace, and you were still a little bit behind me as I was, well, I don't know if you noticed it, but I did. So I play these games, and I'm not trying to imply anything before I ask you about any possible faults. But my point is, those activities become compromised. And when they become compromised, we are in danger of a possible fall. The value added in Tai Chi is probably mental awareness of where we are in our space and our environment. Because unlike instructions. Here's your exercise program. Go to your home, your apartment, and practice these 4 times a day, 10 times for each exercise, da, 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 da. It's all information you gotta remember. That stuff has got to be there. But if I had told you, I want you to stand quietly and imagine that you're a tree leaves and that your feet are the roots and they're embedded into the ground. And your leaves are loose and your tree is as tall as it can be. I want you to imagine the wind gently, just as you've seen in the woods, gently blowing the main branch, the stem of the tree, side to side. These are all beginning elements that go into starting positions of Tai Chi. I haven't given you any instructions on what to do. I've given you a visual image that you can associate with. Historically, you've probably seen it many times. So it is a notion of converting an image or a series of image to movement control. And you become very much aware. So a lot of the beginning positions in Tai Chi is imagine that you're in the middle of a clock. You are in the middle of a clock. I want you to take your left foot and place it at 11 o'clock. And I want you to turn your right foot towards 11 o'clock. Now you are in the start position for a Tai Chi motion. And then I want you to reach forward slowly and come back, keeping yourself as tall as actually as possible. These are all elements of postural control. You have your own range of motion that you have an idea of what you're trying to move. Each of these movement forms, you know what that means. It's basically can be converted to what we would do therapeutically and saying, oh, we're trying to increase rotation in a postural counterwise position. But I'm not going to repeat that stuff. But I bet you if I created an image for you, you'd retain it. And therein lies some of the beauty of this as not just an exercise, it's an art form too. It allows you to process information in the visual cueing that makes perfect sense because you can identify it with past life experiences. And to me, that sense of awareness is what goes into why people who practice Tai Chi reduce time to first emotional thoughts. That's one really important point. The movement forms become part of you. You understand what they are, how to use them. You have all of these forms, by the way. Just one moment. That's as far as the show goes, folks. All of the form, everything I just told you is accompanied by pictures. You don't have to read the words. Just look at the pictures and visualize the pictures. And then you've probably seen videos of groups of people working together, usually in nice, quiet environments, because there's a sense of you in these movement forms integrating yourself in nature, which is kind of nice. Have a quiet place where it's easy to perfectly in groups. The biggest reason we had such success in Tai Chi, in my own opinion, why this is such a powerful intervention, it wasn't the Tai Chi trainers, although they were really good. You know who made this happen? It was the people in the group, because they reinforced one another far more than you're going to get from physical or occupational therapists in the clinic. If you have a bunch of people sharing the same experience, trying to do something together, it's very powerful, very powerful. And there lies some of the strength of this movement forward. So it's kind of like, these are introductory comments. If I'm advocating for Tai Chi, for you guys to experience it with your instructors, please give it a try. It really is something that's well worthwhile and potentially very beneficial. I want to stop. Lenny, you want to come up and say a few words and join in the conversation, give your your input as well. And I really want to do a discussion. I don't want to stand here for 2 hours talking. Yes, ma'am?
One thing that you just said is interesting to me because you talk about the value of it being done together as a group, which if you expand that to so many of our classes that we're doing, our beginning balance, or the fact that we are doing it together.
So,
Read the question.
the question, I think the question that deals with more like a statement, the
Yes.
value of a group-based activity as opposed to doing something individually. And I think there's a lot of value in that because you peers reinforcing one another is far more powerful than an instructor. And then you have the opportunity of talking about it, even practicing on your own. It has a very strong reinforcing effect, very, very strong. Can't state that enough. When I interview, I said, probably worked with over 500 older adults over the years now. I think one of the valuable pieces that comes from this is people telling us that, first of all, they didn't realize they could do what they could do. They are much more acutely aware of how they're moving in their environment. They're aware of moving stimuli and their postural controls of that. To many of us, we don't want to walk a large crowd. There's too many conflicting stimuli. Someone might knock me over. I don't know what goes through your minds. It certainly goes through mine from time to time. But if you have better sense of control of your posture, then that may not happen. Part of what we did all of these years is to answer a very important question. Well, if you're going through this Tai Chi stuff, can we figure out and falling your time to first or multiple falls is later? Why? What's going on here? Is there something changing in your control of your body that is different from the people who were receiving the Tai Chi? And we did those measurements at Georgia Tech. In another lab, we actually measured people's called ground reaction forces, the way in which they push against the ground. Also, what they did with their body posture when they were moved suddenly or had to make a sudden turn. And what we learned is that this one place, our center of mass, which is right about these lumbar vertebrae down here in your low back, 5 of them, between the third and the fourth one, is the center of the mass of our body is located. It also happens to be, coincidentally, the N10, the source, the center of Qi, in Tai Chi, where all the meridians emerge from. Isn't that coincidence? Happens to be the center of mass of the human body. And in fact, what we found out amongst the older adults who were the Tai Chi trainees, as opposed to wellness education, is that the ability to control the relationship and stability of the center of mass with movement initiations was tightly coupled, as opposed to being all over the place if you had that kind of training. So there is an element of postural control in perturbations to sudden movements, which seems to be acquired with this Tai Chi training that we might be losing if we didn't have some kind of exercise form to help us control that. And so maybe why some people said, you know, I lost my balance. I was able to take several steps and hold on to the wall or to a chair, where perhaps prior to that they might have fallen. I'd like to consider that having a partial fall. I'd like to think that that was attributable in part to a movement strategy they acquired by virtue of the training that they had. And so this notion of delays to falls. The value added of where that occurs is probably mostly driven by strategies that we're able to develop by virtue of the training that we've had with Tai Chi. If you remember us doing a videotape, this older gentleman was 90 and was still one of our practitioners. And we're asking him, so are you, because of the Tai Chi training, do you feel that you're better able to move in space? He said, I didn't know I was in space. But I know, so I started laughing, but I know the space around me. So, which is basically very, very astute on his part. It's a funny comment on the one hand, but an acknowledgement on the other that he has some sense of control about his posture and his stability or instability in the area in which he could move his body and feel comfortable securing his balancing. But can I hand the mic to you? So do you want to say a few words of wisdom about your, from the behavioral point of view? Oh, sure.
I have thought for a long time, once we fall, we begin to fall, we kind of lose control. And it could be very catastrophic. You know, you don't know what you hit and such. And so, do you know of any training to help people during the fall process to make it less catastrophic?
Practice falling.
So there is this, I think we've all experienced this in one time or another, this protective response that we have. If you're losing your balance, you tend to move your arms out to break your fall. And when you're going to fall and you can't, your center of mass exceeds your base of support, down you go, it's going to happen, is to brace yourself. Try to stop that fall with your arm. The worst thing I got to tell you a story. June 26th, 2016. I remember that date very well because I had given blood that afternoon and had fluids and cookies or something like I've always done. And then I went to a social event that evening. And I said, no, I don't feel so good. So I excused myself to go to the restroom. And I remember sitting on the toilet seat, just as a seat, and until I felt I was okay. And the next thing I remember, I actually remember, is coming out of the scan of the memory. So what had happened is I had fallen, knocked out about 5 of my teeth. And I had no postural reaction response whatsoever. And apparently I walked out of there with my teeth in my hand and a bloody mess. And I was able to walk to the car, so my wife drove me to the ER. I have no memory of that at all. But my point is, when you were conscious at least, we have a chance of preventing a serious head injury or facial injury or cracked ribs. Rather wind up, I hurt myself with a fractured arm, than a concussion, anything more serious than that, not the facial lacerations or bone fractures and loss of teeth. So the answer to the question is to train oneself to engage these movement reaction times. And how do we do that? There are ways that can be done that I don't think any of you would want to consider. You know, at this point in our lives, you know, these posture machines I talk about, they also have belts. So they put a belt on you, which is suspended, so that if you're not held tightly, but if you lose your balance, you won't fall. The belt will hold you up in place. And what people actually practice doing is deliberately losing their balance so they can practice their reaction time. They're not going to fall. We hold it, and the therapist will stand back into a position. And it's kind of scary, but it alerts us to enhance our awareness of a pretty dramatic training. You fall, and they do something for you. And something's holding you in your belt that will keep you suspended if you lose your balance. And that's one way of doing it. The answer is really, don't lose consciousness. That's why this is important. In your bedrooms, how many of you have night lights that are on? Light lights. A light that's on in your, or a light that's motion activated.
Motion activated.
Okay. The major instances of falls in which you don't control what you're doing is you get up in the middle of the night, you have what's called orthostatic hypotension. The blood doesn't flow to your head as quickly because you're lying down. You think you're okay, you get up right away, and you lose your balance. You're unconscious when you hit the floor. Often when you're in the dark, or near dark, so you're not even sure what you're doing with your arms. That's why it's so important. Even with a night light, everyone better have a night light or some kind of light that's activated in the dark at night. Because once you have to get up, you don't get up right away. You sit there for a moment. Even if you have to rush to the bathroom, you sit there for a moment. You need to be oriented to everything that's around you. You know how many steps is to the bathroom, you know where the furniture is, all those things. You better make sure it's up here when you get up, as opposed to being half asleep, not even realizing you may not be perfusing your brain with blood because you've been lying down for such a long period of time. It's important.
I'd like to respond to EC's comment. I think you're right, EC. If you just fall for the first time, you just can't control it. But if you practice falling, and when I was a graduate student, graduate students don't have any money, but we do things together. So I picked up judo. And I was practicing every other night judo with a group of students with an instructor. And half of judo, or more than half of judo, is learning how to fall. And that's all we do. You learn how to fall, and you learn the techniques in terms of how to fall safely. So EC, you're correct. Now the thing is that as older people, we're more frail. We're not just going to practice falling because something is going to hurt. Or something's going to break. No, I haven't practiced judo for a long time. And partly because I fell too much. And in judo, you grab onto the label of your so-called ki, the things that you wear. And then what they do is they ground the knuckles into your chest. And so my chest is black and blue most of the time. So I said, I just have to know. I'm not going to have black and blue chest and come home and my wife sees it. She'll wonder what I did. But I think it is good if there is such a program to help us practice how to fall, or at least to tell us, when we fall, what should we expect, to do.
I've talked to some of my colleagues about falls, behaviors in older adults, and this notion of being strapped in so that if you fall, you're not going to hurt yourself. That's great, but a lot of clinicians are concerned about the liability. If something happens, what if the strap you're wearing results in a ruptured rib, fractured rib? So there's a hesitancy to engage in those kinds of activities, but to the point where you lost your balance, you're suspended. What do your arms look like? Are you prepared? Have you created the preparation to land? Or even if it's permissible, to have foam, thick foam, and pillows so that you cushion your fall. Shouldn't hurt yourself. But to the extent that one's comfortable doing that, once again, from a clinician point of view, there's this concern about liability. What if this person really hurts themselves? This is the last thing I'd want to happen.
My father-in-law fell numerous times and never hurt himself. Simply he explained that he realized the very first time to just, when he started to fall, he let himself crumble where he was. Instead of trying to catch himself or reach for something, just, I'm going, and crumble right where he was. And he never did get hurt. He needed help getting up. He never hurt himself at all.
So the notion here, if I can just repeat it, so people may not have heard, your father-in-law, when he loses balance, fell several times but never had any severe injuries. And what he would do instead of falling and reaching to protect himself, he would fall into a crumbled position, collapse upon himself. Is that fair? And he never sustained any serious injuries. Think about the movement. I don't know your father, if you know. But think about what that, there's a lot of flexibility in your joints that's required to be able to do that. And so if you have that flexibility in your hips and your knees, you can fall safely in that one position into a collapsed position, that's great. A lot of us as we age can't do that very well, or if we're younger, can't do that well either. It's just, so those are all considerations. Teaching how to fall safely is one can make the argument, maybe we'll start doing that when we're younger, so we will adopt and use that when we get older. I don't know. It's just, is there a way in which that can be entrained safely so people have a sense of confidence? Even in doing balance training with my stroke patients, I want them to lose their, I tell them that. I'm going to stress you to the limits of your stability so that you lose your balance. And I want to be able to take a step. And and they're still afraid, knowing they're in a harness and they're going to be caught. Still, there is this apprehension and hesitancy. So how does one overcome that? Do you go through the training? It's not a trivial question.
Kim and Deborah, do you have any questions?
I had a question. So, what's the role of imagining movements? I know you talked about how it's important to have physical movement, and then it's important also to have that mental awareness. But could we, in the absence, for example, of practicing falling, would it be helpful to maybe imagine falling, or just imagining just in general as a way to train our brain?
Well, that's a good point. So the question that was raising is, can one use imagining or imaging of a fall as a vehicle to train ourselves to be prepared to fall safely and adequately? I don't know the answer to that. I'd ask you what's kind of willingness to visualize that and not say to ourselves, well, I'm too old to even think about that. You got to be willing to come up with a strategy. What am I going to do? What would I do if I lose my balance? How should I fall? What's going to be the safest thing for me? What environment might I be in when that happens? What are the obstacles? How could I possibly hurt myself? Am I on a concrete stairs or steps or street, as opposed to near a bed or in a bedroom where I can grab onto the side of a bed or a chair and drape my fall? All of those are considerations of how we would strategize by imaging based upon the environment in which we would find ourselves. So that poses the question for each. I'm thinking out loud now. When I've lost my balance before, have I tripped over something? Is it the shoes I wear? Is it the surface that I was on? Is it the environment? Am I feel safest and most stable in the environments in which I'm most familiar, like my home? I feel comfortable walking around my home feeling I'm not going to fall, whether I'm wearing slippers or solid shoes or even barefoot. And these are the kinds of redundant questions we have to ask ourselves in order to create an image that we can work with to create a
Any other questions? Yes.
If I'm walking along perfectly normal, albeit it's quite often fast, and sometimes this foot doesn't pick up like it should, as high as it should, and it seems to catch it on the carpet. Is that neurological, or is it because I'm walking too fast?
It could be. So the question
All
is.
of the above.
Yeah. So the question is, sometimes in walking quickly, the foot doesn't pick up the way it should, and it may trip over a rug. And is that?
I just doesn't have any obstacle in the way. It could be right here.
No
And
obstacles.
it's just the foot doesn't come up like.
The leg doesn't come up as it should. And is that neurological or orthopedic, or just a random event that occurs. I think it's probably a little bit neurological because your nerves to your muscles aren't working as fast as they should, because you did say when you're walking fast. You didn't say when you're walking at a normal pace or slow. When you're walking fast. So of course the solution is don't walk so fast. Yes, sir.
We live in a world in which we see people in sports. And I'm wondering if there aren't professional players or people of action who learn how to fall. And I'm thinking particularly, we have a national champion gymnastics team in town. And certainly gymnasts must go through some activities in which they inevitably fall. And they learn how to roll into the fall instead of doing what I did one time, try to catch the entire body weight on one joint. So now I walk around with a lot of pain in the shoulder. Yeah.
So to take that image, the question deals with the capability of gymnasts who have to do some pretty remarkable movements to in their routines, and always run the risk of not landing correctly, or you will fall. That's in proper land. The ones I'm mostly concerned about are the ones on the uneven parallel bars, because that's just a mat there, and especially if you lose it. Yet if you watch them carefully, they tend to fall and turn as they fall. You got to remember, these are people with incredible muscle strength, and they're even the most petite-looking of gymnasts. Strong as heck. And so they can withstand those kinds of forces and pressures. Can I tell you a funny story? In another lifetime, I wound up being on this special Olympics project for the 84 Olympics. Yeah, because we didn't go to Russia in 80, and I was working with the women's volleyball team in California. And the project, we do a lot of work in electrical stimulation. And the project that we were doing involved stimulating the quadriceps, these muscles in front of your thigh. The notion being, can we increase their vertical jump, their vertical height, to block shots if we strengthen these muscles some more? And two things I've learned from that. I could turn up the stimulus strength to max, and it might never affect them. And for a while I thought, I guess the machine's broken. And I saw a contraction, but they don't seem to even react to this intense stimulation. Let me try it myself. And I thought I was going to die. I mean, and I didn't even get half the full output. They are so strong. So totally underestimate their muscle mass, their agility. They have so many things, I think, all super athletes going for them, that a fall, it would have to be like an uneven bars, incredibly awkward. Perhaps a rotation would turn and you lose your orientation. So I don't see the analogies there. I wish we were like that when we get to our ages. We would be having this discussion, but that's not the case. We just don't have that agility or the muscle mass that they have.
I wonder just how center of gravity change.
Does the center of gravity change? Okay, I used to, I taught anatomy for the medical students for many years, and the question of the vertebrae and the discs between them came up when I was teaching vertebral anatomy. And the reality is, I was so joking at the time to the students, saying, does it appear to you that your grandma's will be shorter than she was before? And the answer is, we all get shorter as we get older, because the discs between our vertebrae are filled with a thick fluid, and that fluid begins to desiccate, begins to dry out. As it dries out, the distance between the vertebrae is a little bit closer. We get a little bit shorter. So when we get shorter, then the overall location of our center of mass is different. The spot is the same, but it looks like it's lower because we're lower, right? The center of mass doesn't change. Its location relative to when we're younger seems to be lower because we're not as tall.
Well, a good example, ice skaters, I think when they get older, the center of gravity changes, and they do training a lot, but when that change, the body structure change, the spinning and such is very, very different, and that's the reason they kind of had to quit pretty early, because they just couldn't do the things they used to do because of the body structure changed. Well, well, it could be with aging, but the thing is that the body structure and the weight distribution is different. And so all the training they did is with one type of structure, and they can do it there. But when there's a change, some of them cannot accommodate it. And plus other things is happening. Bob?
Yeah, we find that we have trouble judging distances, so that we find ourselves hitting door jams, for example, that haven't moved and they're where they are. We'll end up with a bad scrape on the arm, even tearing the flesh sometimes.
Okay. Part of the misjudging distances that often results in our banging into something that we didn't before, I think part of that is also, when we think about this, it's not just what's causing that. It may be a little bit of that sequelae of divided attention I was talking about. We bang our arm not because distance has changed, not because we can't swing our arms the way we did before, but we may not be thinking about that spatial change if we're thinking about something else. I've done that several times, where I've banged against something that I shouldn't have. Often I will be going to the refrigerator and looking in to get something, and I know I'm thinking about something else. And then I come out, either I let the door hit me, where I shouldn't, where I hit my arm, usually, against the side of the other portion of the refrigerator, only because I'm not attending. I'm not attending to it. I can't do that. I think even, for me, my divided attention can become compromised in very subtle ways. In very subtle ways.
So related to this, do you have any recommendations? What's the strategy to deal with this?
To deal with that, my strategy is have my wife do all the cooking. Somebody found that funny. Just have to be more aware, move more slowly and deliberately. But I used to be able to think of 4 or 5 things at one time while I'm doing something. I just can't do that anymore. Because I'm going to forget something or do something inaccurate.
We have a reception outside, and perhaps we can go out there and you can talk to Steve one-on-one on whatever questions and that you may have. So the reception is structured so that you can have a personal exchange with Steve or with our speakers. Okay? Well, thank you very much for coming.